So today, we're going to talk about a really fascinating AI tool. It's not trying to replace doctors, not at all. Instead, it's designed to be their indispensable partner, their co-pilot in the incredibly demanding world of medical imaging.
But to really get why this matters, let's start with a question. I want you to put yourself in a radiologist's shoes for a second. It's late in the day, you've already looked at hundreds of complex images. How in the world do you make sure your eyes are just as sharp on scan number 300 as they were on scan number 1?
Answering that question right every single time, well, that's the job. It really highlights the immense pressure these doctors are under. The sheer volume of scans is staggering. Mental fatigue is a real thing. And yet, there is absolutely zero room for error. It's a monumental challenge, day in and day out.
And that's exactly where this new technology comes in. The whole idea here, and this is key, isn't about replacement. It's about empowerment. It's about giving that expert human eye a brilliant and, maybe most importantly, a tireless assistant that's been trained on millions of scans.
This quote just nails the concept. It really is a partnership. The AI is sitting right there virtually beside the doctor, acting as a second set of eyes, a super-fast data processor, and a tool that just helps boost their confidence in that final critical analysis.
So, how does this copilot actually do its job? Well, it's not some one-size-fits-all thing. The system has these specialized modes, so it basically becomes an expert assistant for different kinds of scans. Let's dive into the three main ones. Okay, first up, brain MRIs. We're talking about one of the most complex diagnostic tasks out there. And the process? It's actually pretty straightforward. A doctor uploads an anonymized scan, and the AI copilot just gets right to work. And what's it looking for? Some incredibly critical stuff. It's trained to identify potential tumors, flag ischemic lesions, the kind related to strokes, spot hemorrhages or bleeding, and it highlights any other little anomalies that the radiologist might need to take a closer look at.
But here's the thing, it goes way beyond just flagging potential issues. The AI can create what's called a pixel-perfect outline of a tumor. Just imagine for a second you're a surgeon planning an operation. That kind of precision isn't just helpful, it is absolutely vital.
All right, let's switch gears to a totally different specialty. The system can pivot and become an expert assistant for prostate MRIs, which, believe me, is a notoriously complex area of diagnosis.
In this mode, the AI helps streamline something called PRADS scoring. It's a standard system for grading prostate cancer risk, but it can be a little subjective sometimes. The AI brings this consistent second opinion by finding and measuring lesions, pinpointing their exact location, and even suggesting a risk score from 1 to 5.
And the third major mode is for looking at pulmonary or lung CT scans. The main job here is to find those tiny, subtle nodules that could be a very early sign of disease. Now, the AI doesn't just find the nodules, it helps figure out what they are. Based on things like size, shape, and density, it gives an estimated risk level. And that immediately helps doctors prioritize, right? Which of these cases needs our most urgent attention? But honestly, maybe the most powerful feature of all is what happens when a patient comes back for a follow-up. This is where the AI's ability to compare images over time becomes a real game changer.
Think about it. Trying to manually compare a new scan to one from 6 months ago, looking for teeny tiny changes, it's incredibly time-consuming and difficult. The AI does this instantly. It lines them up, analyzes them, and spots not just growth in something that was already there, but also any brand new findings.
And this is the kind of output it gives. It's clear, it's unambiguous. It's not just, looks a little bigger. It's a definitive statement backed by exact measurements. That level of clarity can make all the difference for a patient's treatment plan. Now, for any of this to actually work in a hospital, the human expert has to trust the machine. That's non-negotiable. So the entire system is built around features designed to create transparency and build that essential confidence. So instead of just spitting out an answer, the AI actually shows its work. For every single thing it finds, it gives its own confidence score and its estimated accuracy. It's kind of like a human assistant saying, hey, here's what I found and here's how sure I am about it. And get this, the system learns. The radiologist is always in the driver's seat. They can agree or disagree with the AI suggestion with a simple thumbs up or thumbs down. That feedback helps the system refine its analysis for that specific case. It's literally learning directly from the human expert.
Okay, this is where it starts to feel like science fiction. The doctor can have a conversation with the report,
I'm not kidding. Instead of digging through pages of data, they can just ask a question in plain English, like summarize the top 3 findings, and get an instant answer. This could completely change how doctors interact with complex information.
Of course, none of this matters without rock-solid security. And this is a big one. All the analysis, every single image, it all stays right there on the doctor's local computer. No patient data ever goes to the cloud, which means total privacy and total compliance.
So let's zoom out for a second. What does all of this really mean in the real world? Why does giving doctors a better tool like this ultimately lead to better outcomes for all of us as patients?
Well, it really boils down to 3 huge benefits. 1, it boosts efficiency by automating all those tedious, time-consuming tasks. 2, it enhances accuracy by acting as that tireless second set of eyes. And 3, it builds confidence by giving doctors hard, objective data to back up their expert decisions.
And that really brings us to the final thought here. This isn't technology that's trying to take over. It respects the incredible expertise of the physician, but it powerfully augments their abilities. It leaves us with a really compelling question to think about. If your own doctor had a brilliant, tireless co-pilot just like this one, what new possibilities could that unlock for medicine and, more importantly, for your health?